Well, Instagram is representing today, and this one comes to us from Howie, who has a non-Ozempic question for Dr. Camejo. Hi, Doc. I know everyone's asking you about Ozempic or Zepbound today, but you know what? It's too damn expensive for this guy. I want to know if there are meds that have the opposite effect and cause you to gain weight. If so, which types are they, and what can I do to stop it? Okay, are you able to switch gears, Dr. Camejo, and get out of the GLP-1 zone and answer this one for Howie?
Actually, honestly, I wouldn't mind a little break, but great question, Howie. And you know what? This is right up Melissa's alley. Marissa, why don't you take this one?
Absolutely. So there's a list of common medications that can cause weight gain. I'm going to go over 5 of them. There's quite a few out there, but the top 5 that I typically see, number 1 would be diabetes medications. Like insulin, they can cause your body cells to absorb more sugar from your blood. And then your body in return will then convert that sugar into fat. And this can lead to about 5 to 10 pound weight gain. The second one would be antidepressants. So this is like SSRIs or TCAs, like amitriptyline, fluoxetine, or paroxetine. These ones can cause weight gain. Some antidepressants can cause it more than others. I would recommend discussing your medication options with your provider if you experience weight gain after starting an antidepressant. The third category is mood stabilizers. These are medications such as clozapine, lithium, or olanzapine. And these mood stabilizers or antipsychotic medications can directly affect the brain and stimulate a person's appetite, causing the weight gain and then affecting their metabolism. The fourth category would be beta blockers. So this is something like atenolol, propranolol, or metoprolol, for example. And these are often used to help people with chronic high blood pressure or other heart conditions. These medications can cause a person to gain, on average, about 2 to 3 pounds of weight within the first few months of treatment. It's best to consult your doctor for an alternative option to make sure that you're implementing healthy lifestyle choices. And the fifth category I would talk about is corticosteroids. So prednisone, dexamethasone, hydrocortisone, for example, long-term use of these types of steroids can lead to weight gain due to the increased cortisol levels, which is the stress hormone in the body. And this can enhance your appetite. So I would recommend limiting the use of the corticosteroids and then only using them for a short period of time. One thing to note that if you're thinking your prescription medication is causing your weight gain, do not suddenly stop taking the medication without speaking to your doctor first.
That was a great question. Thank you so much. Okay, so the next question comes to us from Deborah, who reached out through YouTube. Dr. Camejo, I was at book club last week and I heard from one of the girls that she'd heard from one of her former members who'd been on the pill, was also taking Ozempic, ended up getting pregnant. Can it really happen? Or is this just some urban legend? Okay, I've been hearing about Ozempic babies a lot, Dr. Camejo. So I want to know this as well. Is there some truth to this?
Deborah, good question. Another very typical one. But yes, it is not an urban legend. You know, folks who are obese who want to get pregnant sometimes get put on these medications because it helps improve. You know, obesity increases the risk of infertility. So optimal weight control can improve pregnancy outcomes. But Zepbound and Mounjaro may decrease the intended effect of an oral contraceptive due to delayed gastric emptying. So the problem is your oral contraceptives aren't always effective. And so it is recommended to use an additional barrier method like condoms while you're on these medications. Now, however, weight loss medications, I want to make sure people understand, they're not recommended during pregnancy due to safety issues. And it's not also recommended to try to conceive while you're on these medications due to lack of studies in this population. So if you want to do that, please stop your medication at least 1 to 2 months before trying to conceive. But it isn't an urban legend. People have gotten pregnant on these medications.
There you go, debunked. Okay, let's see what we got here. Okay, here's a Facebook question from Silvio for Dr. Camejo. Hey, doctor, like the guy before said, these new drugs are way too expensive. So will there be a generic version soon? And what about the over-the-counter stuff? Do they work or is it just a scam? Okay, so he has a couple of really good questions here, especially about the over-the-counter stuff and those price points, Dr. Camejo. Can you share a little bit more about that?
Sure. And Sylvia, I appreciate the outreach. And trust me, I feel your pain on this. We get asked all this all the time. But, Marissa actually works a lot with patients in clinic, and she always gets asked this question. So I'm going to let Marissa take this one.
Yeah, this is a great question. So currently the GLP-1 medications, Zepbound, Saxenda, and Wegovy are currently under patent, meaning that they're only available by the brand name. However, drug makers are currently experiencing a nationwide shortage of these medications. And by law, these medications are able to be compounded at compounding pharmacies under the generic names. So these medications would still require a prescription, and I highly recommend discussing this option with your provider. It might be a better financial option for you, but you want to make sure that it's both safe and effective. Now, there is currently one FDA-approved OTC or over-the-counter medication, and it's called Ally. Dr. Camejo mentioned it earlier under the generic name Orlistat. And this one you can buy without a prescription at your local pharmacy. This medication, however, is only shown to have minimal weight loss, so about 3 to 5% of your weight loss from your baseline, and lots of side effects, including abdominal pain, greasy stools, gas, and diarrhea. So I would recommend discussing this option with your primary care provider prior to starting that and to make sure it's a right choice for you.